Assalamu alaikum everyone. So this is my first video in YouTube for the preparation of MRCPCH part 1. As I promised many of my students that I'll go and do some video stations for them so that they can watch it and they can take preparation sitting at home. So that this is why I am here today. So first I am going to tell about the questions which I get every day from the students different part of the world, that how I am going to take preparation for MRCPCH and what is this degree will help me in building my career in future. So first, it is a very prestigious degree, MRCPCH in pediatrics, and as you all know, this is the membership exam which will help us to do practice in UK and some other countries. If we pass this exam, after that we can work as a registrar over there, and it will help in building our future career in pediatrics. So today I am going to talk about MRCPCH part 1. Basically MRCPCH has 3 parts, part 1, part 2 and a clinical part. You have to separately pass MRCP part 1 Tas and FOB part, and part 2 is called AKP, that is applied knowledge in practice. That is also 2 paper, but you can pass combinedly. And clinical part is the last part. After passing all the theory exam, we have to sit in the clinical exam. So MRCPCH part 1 basically it composed of 2 parts. Part 1A, that is we called FOP, Foundation of Practice, and part 1B, that is called Theory and Science. So in part 1A, that is FOP, you will be given exam in the morning, and that is foundation of practice, means what is your clinical judgment, what is your clinical knowledge in managing specific conditions in pediatrics. So in foundation of practice will be judged as the foundation, as the base of your clinical practice. And in the theory and science, that is Tas, this is 1B in the evening, and in that exam you will be judged the theory, the basic science theory of a disease in pediatrics child health. So basically in MRCPCH part 1 exam, this is a combination of your basic knowledge as well as your practical knowledge. I got some questions that how can I help students in preparing their MRCPCH exam. So in MRCPCH part 1 for preparation of Tas, that is basic science, you have to take preparation from the RCPCH books. That books are published from RCPCH, Royal College of Pediatrics and Child Health. The first book you have to practice, that will be Science of Pediatrics, and that is a very nice elaborated book. It's a quite fast book, it's quite big one, but if you read one time you will fall in love with that. And this box speciality is that this book has some specific boxes and has some specific questions and answers with nice explanations. So in MRCPCH Tas, you have to read that book, Science of Pediatrics. We in shortly we call it a SOP book, and that book has some basic knowledge about Tas. So what is the disease pathophysiology, what is the microbiology, what is the physiology, what is the pharmacology in treatment. These basic points are very nicely described in Tas book. And the Science of Pediatrics, this book is basically you have to read because some basic science will come in your Tas exam, like what is the microbiology, what is the cause of this disease, neonatal sepsis, what is the cause of neonatal sepsis, and what is the pathophysiology of congenital cyanotic heart disease or acyanotic heart disease. These things are very nicely elaborated in Science of Pediatrics book. So basically, first time when you see the book, you may be a little bit hesitate to read it because it's quite vast, but knowledge is an important thing in passing any exam. So you have to gather knowledge, you have to gain the knowledge, then you have to pass any exam. So read that book, Science of Pediatrics, and especially before exam, read the boxes, especially boxes and the questions that is given in the very nice coloring boxes like pink, green, blue. There are different coloring boxes, so read that one. And second book, I like to show you my book. This is my book. This is this is Theory and Science Tas book. This book is very nice. It has 50 cases. We call it 50 clinical cases book. And these 50 clinical cases, you will see every system, like there is respiratory system, there is cardiovascular system, there is metabolic system, many systems are there. 50 clinical cases means almost 20 system is covered here. One system, 2 or 3 question in one system. And that book nicely elaborate that how you gonna reach in a differential diagnosis in a disease, how you gonna reach. And that book contains some basic pharmacology also, basic microbiology also. So students often ask me, madam, from where I will read microbiology, from where I will read pharmacology. So basically this Science of Pediatrics book and the Theory and Science book, they provide most information about theory and science exam. So for the next there will be statistics. Statistics is a terror, I know. Statistics, many of us are very weak in statistics, but we have to understand statistics because we are in medical profession. So day by day medical profession is improving by the research, by the audits, by the trials, clinical trials. So for that you have to read, you have to understand the basic statistics. Okay, so read statistics very well. In MRCPCH we have a book, that is Statistics for MRCPCH book, very short book, very nicely elaborated. That book also contain many definitions, many understanding points. So read that book. And one more important thing I like to say, that statistics is important because when you will gonna be registrar, you will conduct some research under your consultant and also in your hospital to improve the quality of patient care. So for that also you have to understand statistics. And second, there will be pharmacology question. As I already told you that pharmacology questions will come from these books. And there is some basic books like USMLE step 1 that also contains some pharmacology. And also you can go through your MBBS knowledge, your MBBS books, pharmacology books. So pharmacology basic will come, not so much deep questions will come. Usually 4 to 5 pharmacology questions comes. So pharmacology, you will find most of the pharmacology in this Tas book and SOP book. Okay, so don't worry about pharmacology. Now the point is sample paper and recalls, very important, recalls, because RCPCH exams, they give sometimes us old questions, that is we call recalls, and this recalls is available in our different groups, different media, social media available, or you can collect it from your friend who passed the exam. Those recalls are very vital. Remember, most of the questions are common, most of them usually repeat. New questions also can come, like some drugs which are very much new, like ivacaftor for cystic fibrosis. It is a new drug and you have to know the newest drug knowledge. And RCPCH has some task lectures that is also available in RCPCH websites. These TAS lectures you will find different system, different like CSF circulation, fetal circulation, you will find statistics, you will find some pharmacology, you will find ECG, basic of ECG. So read those TAS lectures from the RCPCH websites and guidelines. Most important is download the theory syllabus from RCPCH website. And first of all, if you decided to take part in exam in MRCPCH, you have to make an account, RCPCH account. From that account, your all the materials, your all the exam conducts will happen. Like you will book your exam, you will get your exam card, admission card, you will exam notifications in that account, and with a valid mail address. Definitely it will require nothing but your MBBS certificates in the PDF format. You will upload that one with a basic instruction, with a basic information about you, about your job, about your medical college, about your trainings, and then your account is made, and then they will confirm you via your mail, and then they will contact with you time to time. Suppose exam is postponed somewhat due to this pandemic, exam is postponed, so they will contact with you time to time. And I was talking about sample papers. So if you book any exam, there are 3 exams in each year, January and June. There are 3 exams, February and June and October, 3 exams for part 1. And if you book exam 2 months back, then they will give you some sample paper. That sample paper is usually repeat. Okay, most of the time you will see that those are repeat. Sample papers are very important, that are given via RCPCH. And as I said, recalls, past exams are very important. Some questions are there on the online. If you subscribe, like past test is there, on exam question banks are there, you have to subscribe them with some little fees, and that is a best practice. I mean, you can practice at your home, but those questions may not come in exam. That is not correct that those questions from you get common, no, but you will have a good grip about pediatrics part 1 exam. Another important materials for TAS is some basic pharmacology, microbiology, pathology. These all you can read from your SML Step 1 book, and you can read from your SOP book, and you can read from your theory and science books, and statistics you have to read from the statistics for MRCPCH book. So friends, if you have any query and if you want to ask me more question about MRCPCH TAS exam, you can ask me here. I will share the link, you can ask me. And I have a small channel in the Telegram also, you can contact me on that also. I will post the link on the YouTube here. So tell me how it was, and in the next video we will gonna tell about FOP, Foundation of Practice exam. Okay, thank you, take care. Assalamu alaikum.